and welcome to Over the Counter, a half-hour segment that focuses on health. My name is Monique Hammond, I'm a pharmacist, and today we will be talking about delivering medicine into our body by the means of patches. Now, the principle behind the patch is that the skin is permeable to some chemicals and, for our purposes, to medication. And usually we talk about patches as if they were mere band-aids, but the precise design of them is actually quite complicated. Because remember that the patch delivers precise amounts of medicines over a precise amount of time to the body. Now, the patches are made to release the medicine slowly into the bloodstream. And so we think of it as a slow release product. The release is continuous and constant. And since there is a leaching of medicine through the skin, and this is a relatively slow process, there is a certain lag time between the time when we put on the patch and the time when we detect the action of the medicine. Now, this lag time, this waiting period, can be anywhere from a couple of hours to a couple of days. It depends on the design of the patch, and it depends on what medication we are talking about. The patches are usually used to control some long-term problems such as high blood pressure, estrogen replacement therapy for ladies, prevention of chest pain, and so forth. But all patches, no matter what their use, have some points in common. First of all, the patches are applied to a clean, dry, intact skin. Do not apply the patches to skin that is extremely dry, that is damaged in any way, that is calloused, or that has already a rash on it. Limited amount of contact with water is all right for the patches, and by limited amount of contact with water we mean swimming and bathing will not be affecting your patch. But you have to be kind of aware that the patch is there. Don't scrub it with soap and brimstone, and when you towel yourself dry, kind of just gently pat. Don't rub. Be aware of the presence of the patch. Now, sometimes you might have a sensation of burning or itching at the side of the patch. The itching sometimes comes from the fact that some moisture gets trapped under the patch. And this is normal, and it's usually not much of a problem. But if your itching is also combined with burning and redness at the side of the patch, then we might have a different problem. Remember, there are adhesives or sticky stuff on the patch, and that makes the patch stick to the skin. But some people are allergic to those or are very sensitive. And then also you might have an allergic reaction to the medicine that's in the patch. So if the itching and the burning and the stinging becomes a problem, and if you develop redness and maybe even a little rash around the patch area, then please contact your doctor, because you might not be a good patch candidate, and your medicine might have to be changed altogether. When applying a patch, make sure that you have good skin contact, especially around the edges, and rotate the sites. And that means that you have to give that portion of the skin where you just took a patch off, you have to give that portion of the skin a little bit of time to recover before you're applying another patch to it. So if one day you use the right arm, the next day you want to use the left arm, and so forth. And read the provided instructions, because different patches are applied to different parts of the body. Now, all patches are supplied with information to the patient inserts. And this is the opportunity for you, the patient, to learn something about the product. Because in these inserts, the manufacturer talks about the product in general, talks about side effects, precautions, talks about where to put the patch, how to handle the patch. And so read these instructions very carefully, and if you can't read them, then have somebody read them to you, or have somebody explain it to you if you don't understand. And most of all, if you have any questions whatsoever, please call your doctor or pharmacist and make sure that you're sure how to use your patch. Make sure that you know how long your patch is good for, and keep a good record of when you need to change it. Some of these patches last for 3 days, some for 7, And so after a week or so, sometimes we forget when it's time to change the patch. So kind of keep a patch routine or a patch calendar. And when opening the package, remove the patch very carefully. Now the sticky portion is usually protected by some kind of a plastic backing. And the instructions are in your patient information packet on how to remove that backing. Make sure that you do not handle the sticky portion too much. Otherwise you have the adhesive on your hand, but the patch will not stick to your body anymore. And always wash your hands after you handle these patches, because sometimes medicine can get onto your fingers, and then you go and you rub it into your face and onto your eyes, and you might get stinging sensations on your skin. And this is particularly true when we're talking about the scopolamine patch, because some people get scopolamine on their hands when they handle the patch, and then they rub their eyes, and then all of a sudden their vision goes blurry. Now all patches are available by prescription only. And so your doctor will discuss with you when he or she puts you on a patch, first of all, what your other medicines are and what conditions you're being treated for already. Now, our health system is kind of fragmented nowadays. We see a different person for our stomach and a different person for our foot and so forth. But all doctors should know what you're being treated for and what your medicines are that you're taking. And remember when in the previous segment we talked about making out a correct and a complete, inclusive list of our medications? Well, now here is another good reason why you should be doing that. The first patch to come on the market in 1981 was the scopolamine patch. It is used to prevent nausea and dizziness of motion sickness. It has to be applied behind the ear several hours and up to 1 day before one goes on the trip. It is good for 3 days, and the most common side effects are drowsiness, dry mouth, blurred vision, and difficulty in urinating. The manufacturer recommends that these patches should not be used in children and in patients who have increased eye pressure, also known as glaucoma. Elderly patients are the most sensitive to the side effects of scopolamine and should use the patch with extreme caution. The nitroglycerin patch came onto the market in 1982, and I show here only one example because there are many patches out on the market and many manufacturers make beautiful nitroglycerin patches. This is only one example. Now the nitroglycerin patch is changed every day, and the doctor might give you specific instructions as to what time to put the patch on and at what time to take it off. And we try to give people a drug-free period each day in order to decrease the tolerance to the medication. Nitroglycerin patches are used to prevent chest pain and not to treat acute chest pain. The most common side effects are headache and dizziness especially upon changing positions, such as getting up from a sitting position to a standing position or a lying position to a sitting position. If this becomes bothersome to you, then notify your doctor, because your dose might have to be adjusted. Now here I show you an example of a Catapress patch, or also called clonidine. That's the generic name for the medication Catapress. And the Catapress patch is used to treat high blood pressure. It is good for 7 days. The most common side effect seems to be drowsiness. It can also be used alone or together with other high blood pressure medications. It is applied to the upper arm or the torso. Do not stop using this patch on your own. Discontinuing the patch suddenly can bring about symptoms of nervousness and headache together with a rapid rise in blood pressure. This is called the rebound effect. And the patch is also provided with an overlay, and you see the little pouch on the right of your screen contains the overlay. Now this is a little sticky disc that you can put over the patch because it has to stick for a whole week, and that is a long time. So that overlay does not contain any medicine, and it is provided as a protective covering so that to assure good adhesion. Now this is a picture of a package of an estrogen patch, and it is used in women who have lost natural hormone production by the body either because of menopause or because of the removal of the ovaries through surgery. The patch is good for 3 days. It is applied to the trunk of the body, and the manufacturer suggests the abdomen. But they actually stick quite well on the back aspect of the hip. Now, estrogens are always supplied with a massive information to the patient, and this is whether you're using the patches or the pills. And before you start estrogen therapy, you should discuss all of the pros and cons of these things with your doctor. You should read that patient information very carefully, and if you didn't receive any information to the patient in your package, then please call the pharmacist and make sure that you're being supplied with such an insert. Now, after I showed you all of the pictures of the various packets, you probably say, well, now what does the patch look like? Why doesn't she open a patch and show it to us? Well, okay, she'll do just that. I'll show you the nitroglycerin patch. Okay, first of all, again, on the back of the package there are some more instructions for the patient, so make sure that you read those too. You rip the package open, and inside we have the little patch. Now, one thing that we have to point out again is these packages are not child resistant. You have to keep all patch packages out of the reach of children and also out of the reach of pets. And you have to dispose of the patch after you have taken it out, after it is used, in a very proper way. Because there is always, in the patch itself, there is always some medicine left. And that can be dangerous to children and to pets. We don't want them to get into it. Now, this is a disc. You see, I don't know if you can see that very well. But here is the disc, you know. And of course, the disc right now is protected by that plastic backing that I told you about. And so we have to get that plastic backing off before we put it on our skin. And here on this particular disc, there are some lines on the back. See, and you kind of crack this open like this. And then you peel the backing off. See, very cautiously. Try not to touch it with your fingers. And then here is your patch. And that patch then goes where it is supposed to go. Usually the nitroglycerin is applied to the chest. Do you like that? You make good contact. You press it on. You make good contact. Now, before we say something about the nicotine patches, let me make one thing perfectly clear. And that is, of course, you would be putting your nitroglycerin patch on your skin. You don't put it on your jacket. It doesn't do you much good there. But this is television and we can only go so far. Now, the nicotine patches. Now, when these patches first came out onto the market, we had a rush in the patch department because they were heavily advertised, and many people were thinking that this was going to be the ultimate answer for helping them to quit smoking. There were department shortages, there were rationings to the pharmacies, people were on a waiting list. Anyway, it was big trouble. Now, of course, we have an ample supply for all the would-be quitters out there. Now again, the nicotine patch is designed the same way the other patches are designed in a way. And it is designed to release the nicotine into the bloodstream through the skin in a very slow fashion. And this is done in order to help people get off cigarettes by easing the withdrawal symptoms. And the nicotine is furnished without the toxic and cancer-causing chemicals that we can find in cigarettes. Now, hopefully the craving for cigarettes will be reduced through the use of these patches. The patch is applied every day to a clean, dry, hairless preferably, area of the upper portion of the body or the upper outer arm. The patch should be applied to a different site each day. And it should not be applied, like the other patches, to cracked or damaged skin. Now, the patches seem to be doing a nice job in reducing the typical withdrawing symptoms from cigarettes. And this would be like inability to concentrate, irritability, and so forth. But patches alone cannot do the job, because the key ingredient in any quitting program of any kind is always the person, him or herself, and the motivation that they bring along to do the job. You know, if you want to do something or you want to have something really, really bad, you can do it because you are motivated. So the patch is not a panacea. The patch cannot do it all for you. The patch can make the job a lot easier, but you are the answer. Some 70% of all smokers say that they would like to quit smoking at some point in their lives. And usually people make various efforts to quit smoking. Usually it takes between sometimes 4 or 5 attempts before we finally kick the habit. So don't get discouraged. If you fail the first time, there is always a next time. You have to keep focused in these things. You take 1 day at a time, a minute at a time, whatever it is. I'm going to tell you a corny line, but it's so true. Inch by inch, life is a cinch, and yard by yard, it's very hard. It's corny, but it's true. Also, don't say that you're quitting something. Just say you're making a change for the better in your life, for the better in your health, and for the better of the health of your family. And that kind of puts a different light on it. And as a matter of fact, the manufacturers of all of the nicotine patches that we have out there on the market agree on one thing, and that is that the patches should be used together with what we call a behavioral modification program. And that means get yourself into a quit smoking program, or get yourself into some support group that will help you to overcome the psychological aspects of addiction. Because we all smoke for different things, you know. Some people like it because of the nicotine, and some people smoke because it is something social for them, something to do with their hands. They equate it with relaxing and so forth. So you should be really evaluated what the best program would be for you. And call the American Cancer Society or the American Lung Association in your area so that you can find out where there are some programs that are available for you. Now, the manufacturers all try to be helpful, and they provide us, or the would-be quitters, with all sorts of information that should help them along with their patches. For instance, some manufacturer gives out a booklet with all sorts of tips on how to avoid cravings, on how to relax. There are some toll-free numbers that will be provided for you where you can call with questions, and where you can call when you have particular concerns or you're terribly afraid that you can't do it anymore. They are there to help you. But all in all, it leads again to the same thing. You are the key ingredient. Because the patch alone is not going to get you smoke-free. Now, once you have decided to quit smoking, once you have decided to use the patches, then the cigarettes have to go. It's as simple as that. You cannot use both because the heart and the blood vessels can only take so much nicotine. And it is foolish to expose oneself unnecessarily to the increased risk of stroke and of heart attack by using both the patches and the cigarettes. Now, typical signs of nicotine overdose would be headaches, nausea and vomiting, cold sweats, weakness, blurred vision. Some people even end up fainting. And then there is another sign that seems to be very indicative for some people, and that is drooling. Now, the side effects from the patches are few, and they are usually limited to the site of the skin where they are applied. And we talked already about, the burning or the itching or the redness or so forth. But patients also sometimes report difficulties sleeping, sometimes dry mouth, sweating, and then also nervousness of some point. But it is often difficult to decide whether all of these symptoms are just really related to withdrawal symptoms coming through. Remember that the body goes through some major changes when you're making a big change in your life like this. Now, there are 4 different patches on the market that contain nicotine and that are supposed to help us quit smoking. The names of 2 of them are Nicoderm and Habitrol. Now, what they have in common is that both of these products are worn 24 hours a day. The patch is changed every day, and both of them come in 3 different strengths: a higher strength, an intermediate strength, and a lesser strength. Now, smokers of average height and who are not known to have any heart disease and who are relatively heavy smokers are usually started on the stronger dose, then taper to the intermediate, and then taper down to the lesser dose. Whether people who have known heart disease or who are light people, like less than 100 pounds in weight, or people who do not smoke very much, like about less than a half a pack a day or a half a pack a day, are usually started on the intermediate or even on the smaller dose. So that's what these two products have in common, the Habitrol and the Nicoderm. 24-hour wear, 3 different strengths. Now the latest addition in the nicotine patch department is Nicotrol. And it is different in the fact that one wears that patch only 16 hours every day, thus taking a drug-free period during sleeping hours. And this should mimic the smoking pattern of the patient, because hopefully the patient doesn't also smoke while he or she is asleep. Now, since the nicotine levels drop during the nicotine-free period, it is assumed that sleep disturbances attributed to nicotine might be lessened or avoided. Nicotrol is also supplied in 3 different strengths, the higher strengths, the intermediate and the lesser strength, just like Habitrol and Nicoderm are. Now another patch that is available to the would-be quitter is Prostep. And Prostep is also worn 24 hours a day, just like Nicoderm and Habitrol. But it is only supplied in 2 different strengths. A stronger patch, and then for the tapering purposes and for the people that don't need as strong a patch, a lesser strength. Now, as we discussed already before, the nicotine patches are supplied in various strengths. And what does that mean? So, we get the nicotine into our bloodstream without the cancer-causing chemicals, but where do we go from here? Now, the various strengths that are supplied indicate that the whole idea behind the system is that it is a tapering program. Usually, the patient is started at first on the stronger strength of the patch, then after about 4 to 8 weeks on that strength, we are tapering down to the intermediate strength, and then after another 4 weeks on that strength, we go down to the lesser strength. And theoretically, after about 3 months, you should be off the patch and you should be off the cigarettes. If that hasn't happened for you, and after 3 months you are still taking the patches, well, in that case you should reevaluate your attitude towards the whole program, your attitude towards the quitting, and reevaluate your motivation. So how do we decide what patch to use? Well, the doctor will decide that for you. Because again, as I had mentioned also before, not all people need to start on the stronger patch. Not all people smoke for the same reasons, and there are differences in smoking patterns. And so your doctor will decide this for you based on what medicines you're already taking, based on what your health history is, especially your history regarding your circulatory system and especially your heart. And so the doctor will make that decision for you, and you just have to see to it that you are motivated and that you get into that quit smoking program. And then I would mention a little bit something about cost. We have to talk about that too. Now, cigarette smoking is expensive and we are spending a lot of money on that. Patches are not cheap. I have called various places and the quotes that are coming out are about $50 some for 2 weeks, over 100 for a month's supply. But I don't think that this should be a deterrent. Because remember how much money you spend on cigarette smoking, and at least like this, you have some hope of getting off sometime, and again to save all this money. And also check with your insurance company, because some insurance companies will help you pay for the patches. Some pay a little bit on it, some cut you off after 3 months, and some don't pay anything at all. But consider it an investment in your health. It is for the better of your health and for the best of the health of your family, as a matter of fact. But no matter what we do, and no matter how we try to quit, whether it be with the patches, whether we're using the gum, whether we're doing it on our own, the most important thing is that we join a good program and that we keep motivated. Because quitting smoking is a very courageous endeavor. And the first 3 months are the hardest, because that's when 75% of the failures occur. But don't get discouraged. Remember, many people have to quit a few times or try a few times before they are actually successful. And so you got to always think that the next time might be your time if you can't do it today or tomorrow or whatever. Also, the first month where we have to deal with all of our cravings and all of our urges, that's a toughie, but don't let it deter you. Because remember that smoking is the most preventable cause of premature death and disability in the United States. So give yourself a chance. As a matter of fact, some 20% of people can quit without any program at all, or they can do it cold turkey. It's probably not highly recommended because it's a tough one to do. But some 20% of people are able to do it. So get into a program, have yourself evaluated, and see what fits best your program and what fits best your smoking pattern. The trick is that your motivation and your willingness to change your behavior are the key to the success. And so discuss it with your doctor. Do whatever it takes. You will be proud of your success. You will be proud of your effort. And quitting smoking is actually something that you won't regret. And it is a fight, it is a battle. And I myself can vouch for that, because I quit smoking too some years back. And you'll have your failures, and you'll have your urges, but it is a battle that can be won. And anyone who ever quit smoking knows this, and can identify with your efforts. And now, we have come again to the end of our segment. And I thank you all for watching. I wish you the best of luck if you try to quit smoking. Go and do it and see what you can come up with. You will not regret it, believe me. Now next time I will be very fortunate because I shall have with me Dr. John Benton. And Dr. Benton is an orthopedic surgeon in private practice in St. Paul, and he has agreed to come and talk to us about bad knees. So if you want to see Dr. Benton next time, tune in and we will be here with all sorts of good questions. And so we'll all learn something together again. And that's the purpose of Over-the-Counter Focus on Health. And this is Monique Hammond saying, stay safe, stay healthy, you got it. And I'll see you next time. Goodbye.